Have you ever tried radiofrequency ablation, or RFA, to help treat your chronic neck or back pain? It's a powerful tool, but as our next guest can tell you, it can become less and less effective. Today I'm joined by Dr. Mashuri and Dr. Thompson from Arizona Pain. Thank you guys so much for joining me.
Happy to be here.
So I want to ask you guys about people who might have had RFAs in the past, but it just isn't lasting as long as it used to.
There are now much more less invasive and less harmful ways of treating the same problem that gets long-lasting relief, long-lasting results that is also, unlike a radiofrequency ablation, is reversible.
And how does peripheral nerve stimulator work?
Yeah, so a peripheral nerve stimulator, so nerves essentially conduct signals along the pathway, and pain signals are one of those signals that they're conducting. When you have pain, or when those signals are being conducted, essentially it could be because the nerve is irritated or the tissue is inflamed, is damaged, and so those nerve signals are, they're sending these erratic signals to the brain, and the brain's saying, this hurts. And so how a peripheral nerve stimulator works, or which is one of the modalities that we use, is that it essentially regulates and normalizes those signals. So instead of burning the thing down, we actually normalize the signal conduction so that the brain is receiving the type of signal that allows for things to calm down.
What type of technology are you guys using at your practice?
Yeah, there's a lot of different options, and so for doctors deciding which one works best, it's obviously really important to consider the patient's situation. However, one of the ones that we really like is actually a device called Nalu, and the reason that we like it so much is because it's about 27 times smaller than what they used to be. And so for this product, we're looking at, they're doing the right research, they're progressing things the right way to focus on patient outcomes. And as Dr. Moshiri said, this is something that's reversible, and so if it doesn't work, we can actually take that out and there's no harm done. Now, that being said, RFAs can be really effective for people, and we don't want to say don't get an RFA. However, to what Dr. Moshiri said, if these are becoming less effective, if you're seeing you're not getting relief that's lasting as long, this is a really amazing option for you, and this is something that you should absolutely consider.
There's two things I want to add to what Dr. Thompson said. The first thing is that with the change in the insurance environment, insurance companies are no longer reimbursing for repeat RFAs the way they used to. So if you used to get one once a year, and now it has to be once every 6 months, once every 3 months, we find a lot of times patients have to pay cash out of pocket to get that repeat treatment because insurance doesn't cover it. That's number one. The second thing that's really important is that, unlike many things in medicine, this particular technology is one that you can try before you buy. And that is huge. There's not a lot of things in medicine that you can try. If you need a total knee replacement, you're getting a total knee replacement. You don't get to try it out and see if you like it. And this is one of those technologies that you can try it, see if it works for you, and then if it does, then you can commit to it. And it's still reversible even after you commit to it. So there's not a lot of downside.
Well, not only that, but it's also covered by insurance as well.
Right.
Right, and so Medicare and almost every major commercial insurance is going to cover that, and that's one of the things is when technology is advanced to the point where insurance is covering it, usually that's where we get a lot more mass adoption. But unfortunately, a lot of people don't even know that this is an option, and that's one of the reasons we wanted to come on here, is make sure people know if your RFAs are being less effective, there is hope, you can get help, and you can go back to living a pain-free life.
That's a huge burden, I'm sure, of a lot of people, definitely with the insurance portion of that. So Dr. Thomas, Dr. Mashuri, thank you so much.
Thank you.
And if you'd like to learn more information about Arizona Pain, you can go to their website or call the number you see on your screen.